Here I have got a magnified pelvic radiograph on 50-year-old with history of low back pain and hip pain. So I have magnified to show the sacral region. So what we have got here is this obliquely oriented, slightly curvilinear sclerotic line overlapping along the right sacral alum. I would like to call this as overlapping because it is not clear if this is within the sacral bone or is it outside the bone. If it is outside the bone, this can be within the abdominal cavity or within the soft tissue anteriorly or posteriorly. So to further look at this abnormality, it has got this multiple small rounded sclerotic lines. So hence these features are very typical for a suture material. So the suture material is likely to be within the abdominal cavity because the suture materials in the bone are very sclerotic, means the metallic. So these are also metallic, but they are less dense compared to the metallic work which are seen in the bones. This is unlikely to be in the anterior or abdominal wall or in the posterior back because the density is not very dense of a metal. So these features are very typical for a suture material, very likely for a small or large bowel for any surgery. Many times, unfortunately, as a radiologist, we do not get the history whether the patient had any abdominal surgery in the past, especially when we get request for X-ray of the pelvis. But the lesson here is we should not mistake this curvilinear abnormality as something pathological within the abdominal cavity or in the right sacral alum. And the other important thing about this X-ray is we should not be missing this subtle abnormality as well, and we need to make sure this does not represent a true pathology and this is just purely post-operative change.